Good afternoon, Ederachi. Please
Awesome.
tell us about yourself and Vitality.
Everyone, the Bitsolaka is Meteorology. I'm the Executive Director at Vitality Health. The company Vitality Health started operations, its operations in 2014. At that time, when we started operations, we were really focusing more on supporting the healthcare sector with facility management services. We started where we provided support to Queen Mamahato Memorial Services, specifically to under the management of Netcare and its partners there. Focus was mainly on ancillary services such as waste management, removing of non-medical waste, including providing non-skilled labor to support the operations of the hospital. We also provided support in the ambulance services space, where we provided drivers. I think that's where the seat of where we are today began. We operated in that area for a number of years until we saw that the market was sort of needing specialized services in the pre-hospital emergency space. And this came largely because of personal experiences. I think at one stage I had personal experiences where some close relatives of mine had injuries that needed pre-hospital emergency services, and they were not available. A case where somebody is involved in a motor accident and they find that they are critically ill and they cannot get access to life-saving emergency services. So we invested a lot of resources and time to understanding the need, and we saw that this was a sort of a widespread need, whether you have a medical aid or you are a businessman or you are somebody well off. When it comes to pre-hospital emergency risks, we are the same. You will die needlessly if you do not have life-saving services. Now, we then put a lot of resources in that space. Our target was to engage the medical insurance companies into a conversation where we could sell a value proposition that is compelling to them. And unfortunately, back then, this was around 2018, most medical insurance businesses couldn't see or place trust in us as a startup. And we could understand, a small company that comes in with an idea which has never been tested at a large scale, there would be some doubts around it. We went ahead, procured our first advanced life support ambulance. At that stage, we assumed that this will sort of become an incentive to the medical insurance companies, to see that we really mean business. Unfortunately, even when we now presented a fully fledged facility, they couldn't agree. So we were sort of rejected even for the second attempt. My understanding of the rejection was two-front. One, basically because we were a startup. Secondly, mainly because the market did not see a need for our services, even though they were closer. We thought they were closer enough to enable and provide the Lesotho market with life-saving capability as far as pre-hospital emergency services are concerned. We as a country are still, or we're still, relying on a foreign supplier based about 155 kilometers away, offering the same services in Lesotho, but maybe on a lower scale. Why am I saying on a lower scale? It's because my understanding of pre-hospital emergency services is that it includes having the ability to respond to emergencies, medical emergencies, wherever the incident happens. But the clients in Lesotho are comfortable to pay probably their medical aid companies, the premiums, and for a service that they do not get. So bringing these type of services closer home maybe became a threat that maybe it will influence increase in claims, because we'll be closer to the market. And also we'll be starting to educate the people or our community that when a medical emergency happens, wherever you are, pick a phone, call, so that service and help can come where you are. I think at that stage in 2018 we could see that the foreign supplier, the only service he provided in Lesotho was to move patients from one facility to another, and not necessarily to do emergency response. Now, I think this is where our competitive edge came in, and we were able to sell a good story to Basotho. After that rejection, we were left with no option but to establish our own internal medical insurance product, which offers Basotho unlimited access to emergency services, which offers Basotho unlimited access to medical clinic services, and which gives Basotho access to some form of cash. Should they be hospitalized, they are able to get a hospital cash back or cash plan, which gives them money to settle bills in the hospital whenever they are admitted. So that was the first generation of our insurance products, or medical insurance products. And as you can see, this was never our dream to venture into medical insurance. We were pushed there by a rejection, and unfortunately, this has been the driver of the company's success since 2019, when we opened our first doors. I need to mention that in 2019, 3rd of January, that's when we launched the pre-hospital emergency services formally within Lesotho. We started with just one ambulance. I think we are now sitting with a capacity of around 5 or so ambulances that are serving the population at large. We can't say that we have made it. We feel that we are still at the very tail end of our growth trajectory. We anticipate that we will expand our horizons from there. With time, we have become an evolving company, largely picking from the needs of our society. The most imperative need was to close the gap around pre-hospital emergency risks, and we went further to identify other risks around in the healthcare space. So when we define our business model, we take ourselves as a health risk management company, as opposed to perhaps an ambulance company or a clinic. No, we are not a clinic, we are not an ambulance company. We are about health risk management. Recently, we have added the pharmaceutical space into the service basket that we offer. So we do retail pharmacy, we do clinic services and emergency services. I must also indicate that there has been others who were watching as we are delivering our services, and over time perhaps the reputation we have built in terms of the quality of service we provide has gained us some level of trust in the market. As I say that today, we are also involved in the construction of the Lesotho Highlands Water Project, particularly the water transfer tunnel. We are providing clinic services and medical emergency rescue for the project. So those are the new variables that sort of added into the service basket that the company offers. I'm not sure if
okay. In 2020, the country experienced a lot of health emergencies due to COVID-19. Can you say you were able to save lives which could have maybe ended needlessly?
Let me answer that question by going a little bit back. When we crafted our strategy in 2018, we said our vision is to save lives. It is as short as that. And towards the end of 2019, less than a year in operation, COVID started to knock our doors. I think in 2020, we were now feeling its presence. And remember, at that time, we were only having one ambulance on the ground. We had gained traction in terms of membership. So we were able to, because we had lives at risk under our medical insurance product, we were able to stockpile some emergency medication, including oxygen. During that time, we were even called an oxygen supplier, because when oxygen was not available in a number of places, we had it as in reserves to cater for the population that we are covering. So this vision was really tested during COVID. We were the first company to introduce what we call COVID management program, which fortunately enough, even the medical insurance companies that are locally based approached us and placed some of their members under our program. And that is the first collaboration that we saw from the market. So sometimes when we get rejected, it's not necessarily a bad thing. It could be a good thing, because it leads to innovation and creativity. And we ended up collaborating in that space. We also became noticed as one of the local service provider in terms of the ambulance services, as far as the ambulance services is concerned. So I would like to say, under our care during COVID, 2020 up to 2021, we became a pillar of strength for a number of sectors, and we have never lost a patient under our care during COVID. We were providing medical emergency response. We were moving critically ill patients from one facility to another. We call it patient transfer or inter-hospital transfers. And we provided tailored care, where we visited or we took care of critically ill people at specific or designated locations. And these were people who were under our COVID management program. And a number of companies really placed trust on us and supported the operations of the company. As much as we were a pillar for success, for recovery for a number of institutions during that time.
Okay, what is the people's response to your product?
We are introducing a completely new product. When you look at the statistics, the data, I think the household budget survey by the Bureau of Statistics, the latest report, they indicate that only 1.3% of the population is under medical insurance. Compared to funeral covers, where an individual goes with 3 to 5 funeral plans, Basotho are not covered under medical insurance. So we will consider ourselves pioneers in that space. We are not necessarily a medical aid company. We design products that enable our clients to mitigate health risks surrounding their lives. Now, it has been a difficult journey to educate Basotho about the need to have a medical insurance, particularly because we are used to living without it. So until you see the need, maybe you face the risk, a family member gets sick, a family member gets shot somewhere, a family member falls ill, critically ill, and you need the services. That's when it dawns to a number of us that we are not prepared. But for some reason we are well prepared for death. Or your family members, grandparents, even those that are far extended have been covered. And I call upon Basotho to sacrifice at least one funeral policy for a health policy. In Sesotho, these funeral policies divisiwan pateshele. Vitality Health for Basotho bophelo shele. Thank you.
Okay, Khalid, please tell us about the ownership of the health center.
You mean the company?
The company, yes.
Oh, thank you. The Vitality Health is a Lesotho bred company. It's a family business. I think that's the ownership. It's a family-owned business, and I'm the executive director of the company and the founder.
We thank you so much, Dr. Halishi, for the interview.
Appreciate it. Thank you.